Hello, my name is Mbuagbaw. I will be presenting the work of my friend and student, Dr. Frederick Morfaw. He received the Dave Sackett Scholarship Award in 2019. His work aimed at improving maternal and fetal pregnancy outcomes. Postpartum hemorrhage, or bleeding after delivery, is the leading cause of maternal deaths, followed by indirect causes, which include HIV infection. In this graph, you would see that most of these maternal deaths occur in low-income countries. Therefore, it is important to identify effective and cost-effective strategies to reduce maternal deaths. Parallel to postpartum hemorrhage, HIV infection in pregnancy is a major concern affecting more than 1 million women. One of the biggest concerns with maternal HIV is the risk of transmission to the infant. The key steps in preventing mother-to-child transmission include HIV testing, prenatal treatment, safe childbirth, child health visits, safe breastfeeding, early infant testing, child care, and treatment if the child is infected. Some of these approaches can be facilitated by involving the male partner. As part of his postdoctoral fellowship, Frederick had explored barriers and facilitators to male partner participation in prevention programs of mother-to-child transmission of HIV. He set 2 goals for his PhD. The first goal was the prevention of postpartum hemorrhage using misoprostol, which he investigated in a retrospective chart review and by comparing the evidence from randomized and non-randomized studies on the effect of misoprostol. The second goal was prevention of mother-to-child transmission of HIV. Using the findings from his systematic review, he developed a scale to measure male partner involvement in prevention of mother-to-child transmission of HIV. In the chart review study, he analyzed the data unmatched with regression adjustment for covariates, regression adjustment for the propensity score, stratification, propensity score matched conditional logistic regression, and propensity score inverse probability weighting. The results were consistent across methods. Misoprostol reduces the risk of postpartum hemorrhage. In the second paper, he compared randomized to non-randomized evidence on the effects of misoprostol. You will note on this map that most of the non-randomized evidence comes from low-income countries, and this raises the question of how to balance certainty of evidence with applicability. Using Bayesian techniques and classical meta-analytical techniques, or even examining the evidence separately, he found that misoprostol reduced the risk of postpartum hemorrhage. In the third paper, using items retrieved from the systematic review, further reviewed for content validity, he applied these items in a cross-sectional survey of pregnant women living with HIV. He identified 2 domains or subscales, one with supportive items and one with non-supportive items. The 20-item scale is scored from 20 to 100 and can be completed in 5 minutes. The internal consistency is 0.85. In summary, misoprostol can help in preventing postpartum hemorrhage. These findings are true for randomized and non-randomized studies. We can reliably measure male partner involvement in prevention of mother-to-child transmission of HIV using a simple short-valid tool, SAMP PMTCT. This presentation is dedicated to Frederick and his family. Thanks for listening.